Can I now ask Dr. Jack Lambert to make your opening statement, please? Thank you.
Okay. Good morning. So my name is Dr. Jack Lambert, and I'd like to just actually read some excerpts from my address. It covers most of the issues, but I'll just highlight what I think are the important ones. So addressing tick-borne diseases in Ireland. Farmers pick ticks off animals every day. Pet owners pick ticks off their dogs every day. Every farmer and forestry worker in Ireland knows their animals are bitten by ticks and become sick with a variety of bacteria. The sick animals are suffering from tick-borne diseases such as Lyme, Borrelia, Anaplasma, rickettsial infection, Babesia, which causes red water disease in cattle. Do you think these ticks might be biting humans as well? The HSE-HPSC website describes Lyme disease, a tick-borne infection, as a rare disease in humans in Ireland, with 10 cases reported annually, and they estimate maybe 100 cases nationally. A study from the blood bank, however, in 1991, when people donate blood, showed that 9.75% of donors were antibody positive for Lyme. So this is not 10 cases a year. An antibody test means exposure, or it could be active infection. 10% of 4 million, 400,000 persons have had a tick bite. So it's not a rare disease. Okay? How does the HSE estimate of 10 to 20 cases compare to 400 exposures? In addition to Lyme, people become ill from these other infections, Anaplasma and Babesia. There's no recognition of these diseases on the co-infections on the HPC website. I did a study a couple of years ago. People that had a sudden illness and then were diagnosed with chronic fatigue. 25% of them were Anaplasma positive, mostly coming from rural communities. I treated them with antibiotics. They get better. I'd rather have a longer course of antibiotic and be cured of chronic fatigue and have a lifelong diagnosis of chronic fatigue. So many believe there's huge underestimations of the true burden of tick-borne diseases in Ireland. Thousands of annual cases are more likely than 10 or 100. Consider these scenarios I deal with every day. A person goes for a hike in Wicklow and gets bitten by a tick. They don't see the tick bite them. 3 days later, they develop a fever, numbness and tingling all over. Another hiker gets the summer flu and aches and pains all over. A farmer develops migratory arthritis and strange neurological symptoms. They see the rheumatologist, they're diagnosed with rheumatoid arthritis. Nobody thinks Lyme disease. This is an example from Letterkenny just this last week. Lyme should be higher on our list. Some people have a rash, some don't. They may or may not remember a tick bite. But the HPSA website says you should remember a tick, you should remember a rash, but most people don't. 80% of people don't remember getting that. Where do sick people go for tick bites? They go to their GPs. Those who remember the tick bites are told by their GP, and this is what I hear all the time, there are no ticks in Ireland. Ticks don't spread Lyme in Ireland. You only get Lyme in Connecticut. Old Lyme, Connecticut is where Lyme was first diagnosed. Have you traveled to America? You have ringworm. You have cellulitis. Moving down, even though tick-borne infections are common in Ireland, many GPs and specialists are missing the diagnosis. They don't consider Lyme as a possible diagnosis. And when they do consider it, they wait for a positive test. The trouble is the antibody test for Lyme only picks up 50% of the cases. It should be a clinical diagnosis. If you see somebody with a tick and a rash and they're unwell, treat them. Don't wait for the antibody test. But people wait for the antibody test, and if the antibody test is negative, it's only 50% sensitive, they say, oh, you don't require treatment. It's not Lyme. Lyme is a clinical diagnosis. It's supported by testing. None of the consultants, none of the GPs seem to understand that. And there's other strains of Lyme that are being missed, and there's other co-infections that are being missed. So the test often doesn't show positive in patients with active Lyme disease. The reality is, without a positive test, you don't get treatment. People who can afford go to Germany, get special tests done, get special treatment done. But the reality is we need to have treatment in Ireland, diagnostic tests for Ireland for everyone, not just for those who can travel abroad, okay? People say the German laboratories are not accredited. This is wrong. This is a rumour that's spreading in Ireland. Sadly, many people who get the tick bite and rash, like I said, they go get the German tests, they bring them back to Ireland, and they're told by the consultants and by the GPs, we won't touch these tests, we won't accept them. Okay, so this is really the challenge. The treatment then for Lyme is the recommendation on the HPS website is 2 weeks of antibiotics, but many people don't get better with 2 weeks of antibiotics. They're still sick. and then you're told it's post-infectious, live with it. Lots of studies have shown that longer courses of treatment get people better. And what's the harm with longer courses of antibiotics? We treat every infectious disease in the world based on our clinical response, but not Lyme. You treat for 2 weeks and you stop treatment. If you're still unwell, it's post-infectious. So it really is a challenge, I think, for patients, let alone clinicians, to be prescribing when there's guidelines that if you don't adhere to rigorously, you're criticized. What happens if you don't treat Lyme? There's multiple peer-reviewed publications by, there's an American society called Infectious Disease Society of America, 15,000 specialists, and they say the infection's over after 2 weeks. But actually, there's lots of other studies that show that longer courses of treatment benefit patients, but those studies are ignored. A draft of the HPSC Lyme guidelines that I reviewed recently said that even if you get Lyme and you get the infection without treatment, it spontaneously goes away. But it doesn't. There's lots of studies showing that if you get Lyme and you don't treat it, 2 years later, this is a study by Stricker, an infectious disease specialist, that 75% of these people 2 years down the way have arthritis. They have 15% of neurological disease, 2 to 10% have cardiac disease. It affects the heart. This is untreated Lyme disease. None of these studies are included in the HPSC Irish guidance. They're not included in a lot of the studies. During the revision of the International Classifications of Diseases in ICD-11, the codes for the WHO, there's new categories of Lyme disease that identify 5 life-threatening complications, many late-stage and chronic conditions, severe complications related to the brain, neurological Lyme, and congenital Lyme, Lyme that's spread from mother to child. These guidelines have just been released in the last 6 months. None of these guidelines are included in the HSE document, in the HBC document. In contrast, the status of Lyme policy, opinion and stakeholder process in Ireland is very outdated. The Irish government has been fully engaged in the ICD-11 revision process with the WHO that was just released in July of this year, yet the Infectious Disease Society of Ireland and the HSE, HPSC continue to present outdated views in Lyme. They claim Lyme is a rare disease, easy to diagnose, treat and cure, and don't recognise persistent chronic Lyme. And most of the patients I see have chronic persistent Lyme that do respond to antibiotics and they get cured. The HPC is rewriting their guidelines at the present time. Their process, however, only includes the opinion of consultant doctors who don't believe in persistent infection, who advocate to maintain the unreliable testing strategy and repudiate the longer courses of treatment options that patients are getting better on. And these are now internationally accepted guidelines. They are planning to adopt the NICE guidelines. The UK just did a review, NICE guidelines, rubber stamping everything that has been done before. Easy to diagnose, there's no such thing as chronic Lyme, and a short course of antibiotics get people better. They've excluded most of the international peer-reviewed publications and do not accept the WHO guidelines. So why are we copying inaccurate guidelines rather than independently reviewing the evidence? This is what we should be doing. I recently announced the opening of a Lyme Resource Centre supported by private donor funding privately through I work at the Mater. Lyme patient groups have helped to determine the services of this centre. Education and research are the main objectives of this centre. For public education, for signage, for people to know that they should be aware of ticks. Most people aren't. How to prevent tick bites. Training GPs. They are the first ones to see these patients, and they're missing it all the time. It's better to consider Lyme in the differential diagnosis than when you see a bullseye rash, rather than calling it shingles, ringworm, cellulitis. And those are cases I've seen in the last couple of weeks. And also to raise funds for research of these infections. We need to understand better the animals, the humans, the ticks in Ireland. And it's a complex interaction once you get these infections. It's a debilitating inflammatory condition, and then people call it autoimmune. But it's an infectious disease that triggers inflammation and autoimmunity. It's not a post-infectious condition, it's ongoing infection. So there's lots of, the CDC and the European Union have announced increasing rates of Lyme infection. They're now saying there's 850,000 cases in the European Union, 400,000 cases in America. They've upgraded it by 10 to 100% over what they estimated before. You know, we need education, prevention, better diagnosis and treatment for our patients. This is our mission, okay? We need better health for those that we serve. So what does Ireland need to do to address tick disease? The cost of undiagnosed, untreated and undertreated tick-borne infection is not known, but the costs in America are estimated to be huge. The diagnosis of chronic fatigue, fibromyalgia, lifelong disability is huge compared to catching it early and giving better treatment up front. Patient groups and politicians have taken the lead in identifying the lack of diagnosis and care experienced by Lyme sufferers in Ireland. Those persons who have resources can travel abroad and access more sensitive private tests and the treatment option by private care. But what are those people in Donegal who can't afford the bus down to get treatment in Dublin, let alone travelling, paying 5,000 in Germany? There's huge social inequalities in all of this. So there's a clear disconnect between what doctors and the health executive is doing in Ireland as compared to the advances proposed by the Irish and the EU forums and Belgium and the WHO forums. We need to come on board with that. HSC and the Minister of Health leaderships needs to disband the current committees who appear to be rubber stamping current opinions which are outdated and appear unaware of new developments announced worldwide regarding tick-borne infections. Clinicians must treat those who suffer with tick-borne diseases with dignity and support. It's their right to care. Chronic Lyme infection and all of its complications is devastating millions around the globe and thousands in Ireland. It's unprofessional for a doctor who cannot find a cause of illness to resort to telling the patient they're depressed or suffer some sort of psychosomatic illness. This is common in all of the patients I take care of before I see them. The insults. There's a huge stigma and there's a huge ignorance about Lyme. Kind, compassionate and medical care requires clinicians who understand the limitations of their knowledge, limitations of their testing strategies, and who believe the patients when they say they're ill, that the healthcare provider can't identify a source. Rather than dismiss the patient's experience, it's better to acknowledge they're sick, even if the reasons are not well understood. Clinicians need to work with the patients to find the cause of the illness and work with them to get them better. Better tick-borne education and support for GPs in the front line is required so the cost of debilitation and disability can be reduced. An immediate investment of monies into the public hospital system to establish a public clinic for those who can't afford private care is required. All patients in Ireland with these conditions deserve reliable and individualised treatment. A funding campaign to educate patients in prevention and early identification is recommended. In closing, Ireland is a nation of compassionate people who enjoy many recreational activities provided by this beautiful island. Watch out for those ticks. Many of us love to hike, garden, play football and rugby, and simply enjoy the natural beauty of this land. Many Irish livelihoods depend on the land. Our population travels frequently to tick-endemic areas and bring back these illnesses. These factors make most of us at risk for tick-borne infections. I believe these factors also are incentives for Ireland to become a leader in the science and medicine of tick-borne diseases. Thank you.
Thank you very much, Dr. Jack Lambert. And now can I ask Ms. Kerry Lawless to make your opening statement representing TikTok Ireland?
Just to say that TikTok Ireland will be 10 years old next year, in 2019. We've 2,700 members, north and south, urban and rural. The membership is growing, something like 10 people a day over the last few months. In the 24-hour period after the documentary Living with Lyme was filmed, we had 150 people contact us. And that's just the 3 voluntary admin workers on the TikTok Ireland Facebook page. Other individual patients were contacted, other local patient groups were contacted. One particularly active volunteer in the Northwest left her house the following day to go down to Penny's. It took her 4 hours to get to Penny's because people were stopping her, saying, "My child is sick, my neighbour is sick, I know somebody who has this, could it be Lyme? What do? I tested negative, I've tried this, my doctor won't believe me." Or my doctor does believe me, but they don't think that they can actually care for me because of what the guidelines say. And the consultants have in some cases laughed at me. What do I do? Where do I go? So that's in a 24-hour period, and that's what a voluntary group are dealing with. And that's what patients who are sick themselves are dealing with trying to help other patients. So we've a lot of reasons to be proud next year. We're going to do a big celebration for being 10 years old, and we're going to look back on the individuals who've made it possible, the work that's gone on, the awareness raised, the people helped. And then we're going to say, what else has happened in this 10 years? Look at these huge advances in science. Look at this amount of peer-reviewed, validated research that's out there. We don't know everything about Lyme disease and other tick-borne illnesses, but we know a lot more than we did 10 years ago. So much new knowledge, so many advances in clinical practice. And what has the Department of Health done? The HSE done? The Health Protection Surveillance Centre done? Nothing. They have stayed stuck, rigidly stuck, clinging to guidelines, which are contested guidelines, which have been delisted from the CDC website because they didn't meet the strict scientific criteria. And yet we are blindly, rigidly clinging to them and insisting that the earth is flat, and that if they keep saying it, the earth will somehow become flat. And yet what happens with this? When they're blind to the science and they're blind to the new developments, people suffer. People have lost livelihoods. They've had to sell farms. They've had to wind up businesses. They've gone bankrupt. Marriages have broken up. Children have missed school, never been able to go back to school. Mothers have been threatened with having their children taken away by social services because they insist that their child is ill, that this is not a psychological illness, that this is a physical illness that can be cured. So all that has happened in the last 10 years. Luckily, other people have managed to access treatment, either here in Ireland through Dr. Lambert. I'm one. I'm a public patient. Very few of us left. And we've managed to get better. Other people, like my colleague here, Edwin, travelled abroad and got treatment for himself and his son and is back farming. Right. Nikki, who's here, who arrived late, also has gotten treatment. She's gone the herbal route because there's no one way to deal with this, is also in recovery. And so we're trying to make our voices heard for the people who haven't been able to access treatment. Because those 2,700 members of TikTok, how many other people don't use social media, didn't see the documentary, don't know how to contact us, don't know how to reach out, believe what they were told by the consultant, by the GP, their diagnosis of fibromyalgia, chronic fatigue, that they have to learn to live with it, they're on symptom-modifying drugs, painkillers, and these small little lives that they lead, when there's absolutely no need for it, because something like antibiotic treatment or herbal treatments can get you better. Now, maybe not everyone makes a full recovery, depending how sick you were, which co-infections you got, how much damage it's done to your nervous system, and so on. And again, we meet this resistance, as Dr. Lambert has said. They keep insisting it's rare when they don't know because they haven't done studies. They keep insisting it's easy to treat when there are countless studies out there that say that is not the case. Then we're told, ooh, antibiotic treatment, we can't do that, that's dangerous. You have TB, they give you antibiotic treatment. You have your spleen removed and you are on antibiotic treatment for the rest of your life. And the sky doesn't fall in. I've been on long-term antibiotic treatment and I've got better week on week, month on month. I'm not quite there, but I'm here today, and 2 years ago I was in bed. Okay? I'm monitored closely, my bloods are taken, my liver is doing fine, I'm tolerating the antibiotics, I've made the lifestyle changes you need, I'm taking the supplements, I'm protecting my gut health. Because I'm getting proper care, I'm doing it right, and I'm getting better. So why can't everybody have this opportunity? Why is it just because I got lucky enough that I live in Dublin and I was able to access the public system? Or other people who are lucky enough that their communities row in behind them and fundraise for them? 25, 30,000 more for them travel to the States, to travel to Germany, to places to get treatment that they should have here. And yet we're still in this refusal of the Department of Health, of the Health Services Executive, of the Health Protection Surveillance Centre. They have a new report coming out because one of the last times TikToks were here in front of this committee, there was a recommendation from this committee to set up a subcommittee on Lyme borreliosis. So a subcommittee was set up. The so-called experts were all gathered in the room. TikTok nominated a patient rep. And 3 years, they have done very, very little, because I've seen the draft report. I don't know if other people in the room have. And it's completely lacking in vision. It's completely lacking in ambition. They've gone as narrow as they can within the terms of reference. They haven't even satisfied the terms of reference. So for 3 years, every time one of our members goes to their TD and asks for a parliamentary question to go in, we're told, oh, we can't comment on that, we can't do this, the report is coming, the report is coming. Well, the report is there in draft form now, and I wonder why we waited 3 years. And I wonder the number of people who've got sick in the last 3 years, who could have got early diagnosis and early treatment and had their lives back by now, but instead have been allowed to develop a chronic, lifelong, debilitating illness. And we're talking about clinging to guidelines that even recently in this journal article, I think it was last month, was it? Even the contested guidelines that we don't support that came out of the IDSA, even they are beginning to say things like, oops, the test isn't accurate. Oh, maybe relying on this test is suboptimal. And yet, have we shifted? Are we looking at that? We claim we follow these guidelines. We claim we're following best practice. We're claiming everything we do here is based on the evidence. And yet, when the very people who designed the guidelines are beginning to question them, we still say, no, what we're doing is right. We had a couple of meetings since the Cross-Party Action Group was set up last year. There's been huge developments. And the political support we get is heartening, and it's allowed us to make some progress. So we had meetings with the HSE, we had meetings with the Department of Health. We were received very politely. We were listened to. We weren't quite patted on the head, but it was close, you know, because this is quite a gendered issue as well. Like a lot of autoimmune issues, more women are affected than men. So that whole thing comes into play as well. And so we presented our analysis, which I believe has been circulated to you, and we have hard copies for everyone in the audience, of what they say, how the research refutes them, what we would like them to do. And we were told more or less that there might be common ground on prevention. Maybe we could get a few signposts up in the national park. But really, when it comes to things like the testing, like proper diagnosis, like the treatment of chronic Lyme, no, we have to listen to the experts. And we asked them at the meeting, and what we're asking you here today to help us make happen, is that people step back from these fixed positions and people actually read all of the science. Not just the science that confirms what they already believe, but step back and read all of the science that's out there, that's now been accepted by the World Health Organization, and come up with fresh guidelines based on that. Let's not follow the UK blindly and replicate the guidelines that they have come up with. There are improvements in them around prevention, around the acute cases when people are recently bitten, but basically all they did was tinkered around the edges, and they didn't actually grasp how serious this is, how much has to be done, and they certainly didn't do anything for people who have chronic Lyme. And that's a group that have been, the reason I had chronic Lyme for 10 years was because I was undiagnosed, misdiagnosed, denied adequate treatment. There was absolutely no reason for me to lose 10 years of my life. And there's no reason for the thousands of other people across Ireland to be losing years of their life. We're talking about treatment protocols that work. We're talking about antibiotics. So for us to then now follow the nice guidelines blindly, and for someone from TikTok to be back here in another 10 years, telling you that more and more people have been bitten, more and more people have got sick, more and more people have lost their farms and become bankrupt, that's just a scandal, because there's something we can do about this. And something else that was in the draft HPSC report that I saw is it's been suggested that one of the recommendations that's coming is a new subcommittee is set up to develop new guidelines. So what I would like to ask here today is, the very people who misdiagnosed me and other patients, the very people who denied us treatment, are they the people who are going to be sitting around the room devising these new guidelines? So you're going to say that the people who for the last 10, 15 years have ignored the science, have refused to read the new research, have refused to keep up with evolving clinical practice, that we suddenly trust them now to come up with effective guidelines for the Irish health system? I'm sorry, but no. The reason we are in this mess is these very same people wouldn't read the science, wouldn't keep up with evolving clinical practice, and have stuck to this idea that science never changes, medical practice never evolves, there's no new knowledge. So there has to be a fresh group of people in the room, and there has to be people who actually have a background in Lyme disease, in treating patients and getting patients well, if we're going to have meaningful guidelines and a meaningful change for practice. So this is where we need your help. We need political pressure to bear, because the medical community have, as a patient and as a layperson, and maybe I'm being unfair, at consultant level have shown themselves incapable of change. There are lots of good GPs out there, and I might ask Edwin, a text message he got yesterday sort of sums it up. There are a lot of good GPs out there who want to help their patients, and they're scared to, because they don't have the backing of a consultant. If they prescribe over the 2 or 3 weeks antibiotics, are they going to be in trouble? So if I could just say for Edwin, and then I'll wrap up.
Ms. Lawless,
Yeah.
thank you for your opening statement.
Yeah.
I'm going to move on to,
Sure.
to the committee members. Obviously,
Yeah.
Mr. Sims, you'll have an opportunity to come in.